Good day! I am Lisette Ann Balagtas and this is my return demonstration of urinary catheterization. So before I begin or before we start, I have few reminders to say. First, the things that I'm going to use or some of the things that I'm going to use are improvised materials only because this is for return demonstration purposes. Second, the client was not hurt nor forced since I am going to use a teddy bear. And third, only professionals and trained healthcare team are allowed to do urinary catheterization, so don't do this at home. Let's begin. Urine catheterization is used to help with urinary discharge when it is medically necessary. So here are some of its indications. If the patient is unable to pass urine due to an enlarged prostate, blood clots, or the bladder is unable to empty due to neurologic disease or pharmaceutical impact. Short perioperative use, less than 24 hours in certain procedures, urologic tests, or surgery in adjacent structures. And measure urine output and get sterile specimen for certain laboratory tests. So first we need to check for the physician's order and then we're going to check the client's chart. So the rationale behind this is for us to verify the procedure that we are going to do and for us to check if the client has any allergy. So next is we're going to the patient's room and then we're going to identify the client. So in identifying the client, we're going to use two identifiers. So it's her name and then her birthday. So the rationale behind this is for us to know if we're going to handle the right client. And then we're going to introduce ourselves. So the rationale for this one is we're going to build rapport to the patient. So this one will ease her anxiety and will make her comfortable because she will know who's going to handle her. So we're going to, of course, explain the procedure to the client. So the rationale behind this is for her to know how she can cooperate during the procedure. And then we're going to educate her why are we going to put some urinary catheterization so she will not be confused on why are we going to put on some urinary catheterization. So good morning ma'am, I am Lisette Ann Balagtas and I will be your nurse for today. So I'm going to do the urinary catheterization. So may I have your hand ma'am? And please state your name and your birth. Okay. So how are you feeling? Are you nervous? So don't be, because I'm going to do this procedure with extra care. So let me just say this ma'am, urinary catheterization will help you excrete your waste, your urine. So due to some major surgeries, you cannot excrete your urine on yourself. So that's why we're going to do the urinary catheterization. So relax ma'am and be comfortable in your bed. Next is the gathering of the equipment that we are going to use. So the rationale behind this is for us to save time and energy during the procedure. So as you can see, some of the materials here are improvised materials only. So after that, we're going to provide some privacy. So providing some privacy will help her ease her anxiety and make her feel comfortable during the procedure. And also this one will save her dignity. Open the catheter tray using aseptic technique. Place waste receptacle in accessible areas. So I have my waste receptacle or trash bin at the bottom part. And then assuming that the table was also clean. And then this one is my catheter tray. Position client in dorsal recumbent position with feet about 2 feet apart, then drape. Slide the waterproof pad under the client's buttocks. This position will give us an easy access during the procedure and will make her feel comfortable. So after that, we're going to wash our hands and then we're going to put on some gloves since we're going to touch the sterile equipment and also the genital of the patient. So the rationale behind this is for us to prevent the cross-infection or putting on some bacteria on the patient since this procedure or method is an aseptic one. So make sure to provide direct light for visualization of the genital area so we can see properly the genitals during the procedure. Now we're going to put the waterproof pad under the client's buttocks, so the fluids that will fall will be catched by the waterproof pad since this one is an aseptic method. So here I place the sterile tray on the drape between the client's thighs so I will have an easy access on the materials, and then I also put some drape on the vagina where I will clean the labia minora so the fluids will not go around her genitals. So I open the cotton balls, and then I have here an improvised betadine, and I'm going to put it on the cotton balls to cleanse the urethral mucus. So make sure that you put on the sterile gloves. So this one is an aseptic method, and we're going to touch the genitals. So separate the labia minora to visualize the urinary meatus. Cleanse around the urethral meatus with antiseptic solution and downward stroke from anterior to posterior. And then we're going to dispose of cotton after each use. So again, this one is an aseptic method, so we're not going to repeat the cotton balls when we are going to wipe it with the other side of the urethral meatus. So bear with me if I'm holding the sponge like that, because the sponge will fall off if I'm not going to hold it like that since it was just clipped, and this one is an improvised. So after cleansing the urethral mucus, we're going to dispose the gloves that we used, and we're going to replace it with another sterile glove. So before that, don't forget to wash your hands. So as you can see, I already put on my new sterile gloves. I wore a mask and a hairnet because this one is an aseptic method. And then this is my size 12 Folly catheter since this one is the only size available. So there is a syringe attached to it. So first we're going to try if the Folly catheter will inflate. There I will also connect the drainage bag. So make sure the Folly catheter will inflate, and that may also make sure that we can aspirate it back. Introduce a well-lubricated catheter 5 to 7 cm into the urethral mucus using strict aseptic technique. Place the drainage end of the catheter in the urine receptacle. Hold with the uncontaminated sterile gloved hand the insertion end of the catheter about 5 cm from the insertion tip. Allow some urine to flow before collecting specimen. So lubricating the catheter is very important because this one will give us an easy way to insert the catheter without causing any pain. So after we've inserted it, we're going to inflate the balloon. So slowly push the syringe and then hold the labia minora. So bear with me again on to this one because I'm really having a hard time since the sponge was about to fall off. That's why I'm going, can check it if it was inserted properly by shaking it a little bit, and then if the Folly catheter will not fall off, then it was properly inserted. So here, a reminder, you are going to take it not under but above the legs of the patient, so it will not give pressure. So after doing so, don't forget to remove the gloves and wash your hands, and also remove all the materials that we've used. So this one is the Folly catheter. So don't forget to wash your hands and put on some sterile gloves, PPEs, your hairnet, and then your mask, and then we're going to deflate the balloon. So if you're going to collect some specimen, you may do so. And for this one, we're going to remove the Folly catheter. So we have here a towel and a syringe. So I deflated the balloon, wiped the genital, and then warned the patient that you're going to pull the catheter. Then we're going to pull it slowly. So that's it. We already removed the Folly catheter. So after the procedure, we're going to put away all the used materials and place it on a waste receptacle. So this one is an aseptic method. So all the used materials after the procedure are non-aseptic. And then we're going to help the client to put her on her comfortable position. And then after that, we're going to remove all the PPEs that we've worn. So the rationale behind this is for us to prevent any infection that we can pass or bacteria that we can pass from client to nurse and nurse to client. And then here comes in the part of the documentation. So we're going to assess the before and after of the procedure. So for us to know if there are any adverse reaction that was made after the procedure. And then we're going to write on the patient's chart the type of the catheter, type and size of the catheter, the amount of urine, or if we're going to put on the urine onto the laboratory test. So onto the urine, we're going to chart the amount, color, the smell, and the texture of it. So after that, we're going to thank the client for cooperating and leave the room quietly. So that's it. That is my return demonstration of female urinary catheterization. And I also did the removal of the catheterization. So again, some of the materials that I've used were improvised materials only because this is for return demonstration purposes only. So bear with me if you saw any non-aseptic method that I've done and then non-aseptic materials that I've used. So have a good day and thank you for watching. I hope you learned something.